everyone. Hello from Liverpool. I've got a really cool person with me. I've recently met him. He's done really interesting things in the sphere of healthcare and beyond it. We have with us today Dr. Naveen Kirti. I'm gonna let him introduce himself because he does a really good job of it, and I'm terrible with names. I will drop his LinkedIn in the doobly-doo below so you can read up more about him, connect with him, and over to you.
Thanks, Rupali. Thanks for the opportunity. Hi, everyone. I'm Naveen. I'm a doctor, an IMG doctor, particularly like most of you. Moved from India almost 18 years ago and been working in the NHS ever since. Done a fair bit of things. I started like you with a lab 2 exam and subsequently started working in NHS as an locum equivalent to an F2 job now and basic surgical training. Because I wanted to move more into the A&E and the trauma side of things. And I didn't get the training number in time. Enrolled for MD in orthopedics and completed my diploma in sports medicine, worked with sports club. And most recently, I think this is the interesting side from my point of view. I've done 3 fellowships with NHS England. One of them is called as a Clinical Entrepreneur Fellowship, Doctors with New Ideas, or NHS staff, any staff for that matter. And I've become a mentor on the program now, and UCL Partners Innovation Fellowship and MSc Innovation Fellowship. My focus has been on the workforce because I saw a trend in terms of the deficiency or the vacancies rising up, and then again there is an oversupply. I think we'll elaborate and talk a bit more about it, but this is generally the background. And finally, I started my own recruitment agency to support NHS and doctors like me, IMG doctors, and it's called Doc2UK, like Doctor to UK.
It's a very cute name, I must say. Very succinct and to the point. So because you're here as someone who's got experience in recruitment and can you simplify the process for IMGs coming in and what the current situation is like for non-training jobs?
I mean, the first part I can do it really well, I think. The second part is a really complex answer. The first part, for any IMG doctor to come and work in the NHS, there are 3 essential criteria, I would say. Number 1, your medical college has to be a valid one. So there is something called WDOMS, World Directory of Medical School. WHO organization, World Health Organization runs this. And they've got a network with every single medical school which has come up in every different country. You need to be completed your MBBS or qualified from this WDOMS approved medical college. That is requirement 1. Requirement 2, your level of English knowledge has to be to the same standard as that of a doctor working here and communicating with the patients. So I studied in India. The medium of instruction has always been in English. That is starting from age 4, year 1, all the way upwards till I completed my medicine. But that is not still sufficient because my engagement with the patients has been in the native language. So we need to justify that our language is good and the communication is on par with the local doctors because it has to be, we are communicating with the English-speaking patients. And that is assessed by the IELTS academic, please remember, or OET medicine. Once you meet the requirements, then you move to the 3rd stage. Your clinical knowledge has to be to the standard of finally a medical student. By the way, I didn't mention earlier, occasionally, finally a medical student examiner as well in the NHS or in the UK. And so that is being assessed by different modes, but then there are 4 modes which come really into the foray. Number 1 is you have to pass both parts of the PLAB exam conducted by the GMC, General Medical Council. It is a regulatory body for the all medical healthcare practitioners in the NHS or in the UK. Second one is any Royal College membership, but all parts completed. That could be an MRCP conducted by the Royal College of Physicians, MRCS conducted by the Royal College of Surgeons. Only exemption is FRCA. If you complete part 1 of FRCA, that's fine. But otherwise, MRCOG, MRCP Psych, all 3 parts have to be completed. The third route is called MTI, a bit complex, but a lot of them can Google on MTI. Remember AOMRC and FAQ, frequently asked questions. You'll get a lot more information about the MTI route. Fourth one is sponsorship. There is an exam. This is not a common route, so I would not necessarily encourage a lot. But then some hospitals have the opportunity or kind of provision to directly sponsor GMC registration. So once you meet the WDMS requirement, English language requirement, clinical knowledge requirement based on these 4 criteria, then you get what it's called as the GMC registration. That will allow you to work in NHS. I hope this part is clear.
Right, exactly. So I will put some resources in the doobly-doos to help you read more about the ways I came through the PLAB route. I think Naveen came through, you came through the PLAB route as well, which is one of the most common ways to come in, especially if you're a new grad. I have some residents who've come from my college from the MRCS route. So again, there are multiple options and you can explore all of them and see which fits you best. The second part of the question, which is more tricky, as Naveen mentioned, do you want to elaborate more on what the situation is like?
I do have some slides actually, if allowed, or maybe at a later point, I can share them as well. So I want to run through the numbers essentially. And is it okay if I share my slides?
Yes, please go
Prabhat?
ahead. Are you able to?
No, just make me the co-host.
Yes,
So.
just a second. You're the host now. Go ahead.
So I guess you can see my screen.
Yeah.
That was me 18 years ago when I first came in to the UK. And these are the things. By the way, I work with Silverstone as the racetrack doctor. Used to do a lot before COVID for Formula One, MotoGP, and even small races because of my trauma experience. I did a mini MBA from Stanford University as well for entrepreneurs and innovators. But just jumping into this is the data or the list of the number of doctors who have come and registered with the GMC from overseas, non-EU countries. And we call them, as you know, IMG doctors. And this is back in 1989, and this is only the first 3 months of 2022. That is what I had the data gathered. But then I know the numbers speaking to the GMC, that 22 and 23 is exactly the same as 21 year. So you can see that the recruitment comes in cycles. So there is a surge over here. 12,000 doctors have come and registered from overseas with the GMC. And I found the pain because when I came over here in 2005, 4 and 5, it was really hard. It took me like 380 applications and there were no online submissions. You need to print out your CV and then send a copy to them. And that is how the system was back in. There is no Facebook, there is no WhatsApp, there is no Zoom, definitely. So but had print them out, and then obviously with the little money what we come with, and you have to kind of funnel that and then make the best use of the resources. It was difficult time, but managed to squeeze through the system. And again, a lot of doctors stopped coming. The reasons behind, there are some systems put in place to favor, obviously, sometimes the local graduates, and then there was an saturation as well. But now NHS is going to this phase where there is a bigger requirement. I'll give an example, classic. I think in 2014, 15, I was working I just started working in A&E. I was in orthopedic predominantly for the longest time. And we used to be 3 doctors on a night shift. Now in the same hospital, same department, there was a small minor A&E department which is closed, but again, that should not influence to this extent. There are 8 doctors in the night shift. 1 doctor short, everybody goes in a panic mode. There is an expansion which is kind of happening. And the number of consultants were 18, and I think now there are 34 consultants in the same organization as well. So this requirement surge, maybe always seek more doctors as well. So there is an opportunity, but I know the trouble going through this phase, and then it would be the same one for the most doctors coming in. There will be saturation. And again, there might be a slump followed by another spike, just like what has happened now in the last few years. I will not go more, but this is again the data from the GMC. But if you look into this, so doctors who come like us, you and me, as an IMG doctors, Roughly, there are 283,000 doctors registered with GMC who have got the license to practice and work in the NHS or in the UK. And doctors in training are roughly 70,000, but all of us would fall into the 63,000 category.
Mhm.
We're all the SAS and locally employed doctors. Locally employed doctors, that includes clinical fellows, junior, senior, specialty doctors, and say registrar, senior house officer, or foundation 2 equivalent non-training job or elite jobs. All of them come into this category. And then here comes, this is the consultants, this is the GPs, and this is the doctors who have done both, been a GP and then moved into the hospital, or been a hospital doctor and to the GP. But so now there is almost 30 doctors coming to fill into this place. So as we look into the previous slide, this number is almost close to 30,000. I'll stop there. So I will leave for the new lab doctors or aspiring doctors to think about it. I don't want to discourage. I've been in a difficult situation. Loads of my friends have been in the same place as many. We finally squeezed through the system and then found our way through in the NHS. And there will always be an opportunity for others too. But then it will get competitive, as you probably have evidence in the last 1 or 2 years.
Right, I think that's a really good point and very succinct way of describing it, because I think a lot of people come to the UK with the idea that it's very easy to get jobs. And I think post COVID, it was where everyone, whoever freshly graduated, didn't have to do much to get a job. But that's not the same anymore. Like, it's getting more and more competitive. So you need to have something extra, something different than the rest of the people applying to stand out, basically. And it is competitive, so I don't want to like make it look like this cakewalk, because a lot of juniors are also coming in with this idea that it's this whole cakewalk, and they're just standing at the airport with a with a plaque or with your name on it, ki wow tumhe job denge. But it's not like that. So it's important to be realistic. That doesn't mean there are no jobs. It just means that you have to work to get it, and people do get jobs. It takes 6 months, maybe 3 to 6 months, maybe more, but people do get jobs sooner or later. Since we've discussed the job situation, we've touched upon the saturation or the competitiveness of jobs now in the NHS. Can we move on to giving some tips and tricks to IMGs who are coming in, and what is an approach that they can take to improving themselves?
Tips. And so I'll give evidence or examples, having spoken to, obviously, over these 18 years. That's a very long time. I've made so many friends, and most of them are consultants in the NHS. I speak to them regularly. We have WhatsApp groups, or we meet up. And then as part of my recruitment journey, the agency which I started myself, Dr. UK, I engage with a lot of the HR teams as well. There is inefficiency in the system at multiple places, but at the same time, that there is a bit of an extra work, because the clinical work in NHS is really stressful. I think, say, if I go back, like, say, 10, 12 years ago, we would come and enjoy the work. And most doctors or most staff working in NHS. But now the enjoyment factor is being slowly kind of fizzling down. So you're coming for the month end paycheck. And as such, the clinical work stress puts on. Now the shortlisting and the job interviews is not necessarily that straightforward. With the search, particularly because we are referring and mostly going to talk about the PLAB doctors at that junior grade position. By the way, I would like to break this down. Say you break a doctor job in the NHS equivalent to 3 tiers. Tier 1 is like somebody who has finished a final year MBBS. To the first 4 years, you can call them as tier 1 jobs. These are all, you have different titles for them: junior clinical fellow, ST1 equivalent, ST2 equivalent, or F2 doctor, or a locally employed doctor. So they could be any title, but they work at an SHO grade, what I call, because that is how I was titled when I first started, senior house officer. And the job is predominantly see the patient, make sure that the patient is good, get the history, clock the patient, and discuss with your registrar before making big decisions. Small decisions, starting on antibiotics, yes, you would make them, but discharging a patient with an, say, 2 lead T-wave inversion on an ECG, complaining of chest pain, 42-year-old, I think SHOs won't make the decision, hey, you can get home. Usually that decision is left to the tier 2, tier 3 doctor. Tier 2 is the middle grade, which is the registrar, specialty doctor, senior clinical fellow. These are all the different titles, ST4 equivalent, ST5 equivalent, or in the training as well. They are really the backbone, and they are the ones who make the most important decisions. And then the third tier is the consultant grade. Right. So coming at this tier 1, because lab doctors apply invariably, all of them apply for the tier 1 jobs. The tips and tricks, one of the HRs I was speaking to for two F2 equivalent jobs, non-training jobs, there were close to 800 applications. It's really hard for the HR to make a decision, hey, who I need to pick. And now the HR has to send the shortlisted doctors to the clinician to again do the second round of shortlisting. Say from 800, they have come down to 100 based on the essential criteria. Everyone go through the essential and desirable criteria. This would be my number one tip. Make sure that you meet the essential criteria. That is the basic requirement. And then you need to work towards your desirable criteria. Submit your application even if you don't meet the desirable criteria, but you need to know that this is what the hospitals are looking for your next round of applications. You want to meet them. And usually they are MRCP or MRCS or MRCOG, at least part 1 of the exams, completion of your ALS or ATLS, and maybe some UK NHS experience. That could be your clinical attachment experience and so on. So if you work on one of the 3 areas, then you increase your chances. So the shortlisting from the HR to the clinicians would make the decisions at this point. Roughly for those 2 jobs, they will identify the 20 doctors from this 100 list, and then they would coordinate and conduct the interviews. Or there is a good chance that they might be just given these 20 shortlisted doctors to recruit for those 2 placement or 2 positions. So these are 3 my really top tips or tricks. 1, go through the desirable, essential and desirable, followed by these 3.
I find it really interesting that you've mentioned that, because when I was doing my attachment is when jobs were opening. So I saw this process happening like in front of my eyes. Because when you work in A&E, there's like consultants around, the registrars are always around, and they discuss these things. So you can sort of figure out what's going on. And I found out that the HR sort of sits with a checklist of like essential criteria and desirable criteria. And if your job application, if the words are not similar to what they're looking for, then a lot of the times they'll just filter you out. And if you're not meeting like the essential criteria or the desirable criteria, they'll filter you out. But there are ways. So if suppose you don't meet all the essential criteria, but you've done an attachment in that trust, they will give you a shot. They'll just give you a shot. They might take you for an interview, but after that it's your own caliber. You still have to beat everyone else who's met the essential criteria. So as Naveen mentioned, it's quite complex and it's a little variable, but those 3 tips are very good and things to work on while you're applying for jobs and waiting for the right opportunity to come along. Since we have discussed tips and tricks, the next thing I want to ask you is something that a lot of people ask me. If I can only do one thing, what would you recommend? ALS, a Royal College exam, or an attachment? Because it costs money, right? This whole process needs to be financed, and we need to bear in mind that the cost of the things also play a part in it. So if you could choose one, how does it get importance?
I'll give a long answer, please, Rupali. Please allow me to do that because this is crucial. For example, I think the circumstances change based on the person, or my advice changes based on the person. If, for example, that you're coming on a spouse visa, or you are already here in the UK, like most of us, when we came for your PLAB 2 exam, because you have to come and do it in Manchester yourself. So that was the time where apply and get into an attachment. Attachment would be the number 1 advice I would give. So that is how I found my job. Most of my friends have found the jobs at the place where they're doing the attachment. You need to be really diligent and religious with your commitment in the attachment place. You need to build that rapport and then build that commitment so that the person, the consultant, the nurse, or the registrar can say that, hey, by the way, we can employ Rupali, we can employ Naveen. Let us shortlist them as well. I know that they may not meet the desirable criteria, but essentially they have got the GMC. So you stand a better chance. And always, I think a known devil is better than an unknown angel. So that way you stand a better chance. But if I had given my PLAB 2 exam, not being really very diligent about my attachment, and I didn't find a job, I had to go back and working in India, for example, all the way applying for an attachment, coming to UK to get a second try, I think I would not do it, and I probably would not advise it. If you're in a situation like this, if you're there around those 1 in 12,000 doctors who are in your home country after you've come to UK, completed your PLAB 2 exam, had to go at your attachment or never got the attachment because you had to go back, maybe the other two you would be your best options, which is MRCP or MRCUG or MRCS Part 1. ALS, when you're applying for a non-training job, ALS is a knowledge. Certification will help. If Apollo Hospital, where I used to work, for the local doctors in the organization, it's free. Anyone from a nearby hospitals want to come and join, they would have to pay 2,000 rupees, roughly 20 pounds. It's a one-day program. And this is back in the time. I'm sure most hospitals conduct it. You don't have to spend 550 pounds to come to UK to do the ALS and then recess UK approved institutes to do that. I think that's okay to do it conducted by American Heart Association or your local hospital. Remember, it's a knowledge which you want to display in your CV. You're not saying that recess UK conducted ALS only. Attend that in the country wherever you are and get it out of the way because it's knowledge and then you're showing it on your CV. But focus and prepare for your membership exam. Long answer.
No, but I think it's really practical advice because it's a very subjective choice to make, as you said. And especially the Royal College exams are a great way, especially if you know what you want to do. If you're 100% sure that you want to do OBGY, if you want to do medicine, if you want to do surgery, I would 110% agree that go for it. But if you don't know yet, because a lot of us come in thinking that the NHS works a certain way, that specialties work a certain way, and then you get disillusioned when you start working and you're like, maybe it's not how I thought it was. So I think it's a very subjective way of looking at things. So try to find the best option for your situation. And as Naveen mentioned, don't fly back for an attachment if you can avoid it, because again, it's the cost of flights, the cost of living in the UK again, it's the cost of paying for the attachment. So it's a very expensive option. If you're there for the exam, definitely do it. Moving on to part 3 of our interview. Since you started Doctor UK, can you tell me a bit about what got you interested in it and how it actually came about to being as successful as it is now?
I won't say it is successful. But I can tell you, I mean, success, I think that everybody has got a different yardstick to measure it. For me, the measure is like, say, in the last 1 year, we have recruited compared to other big agencies, roughly around 60 doctors, a little more than a year. But every single doctor is happy because we had the commitment, because we had a personal journey, and then we shared that experience like this, and then many others, and we provided the support to the doctor. Let that be like how to open a bank account, get a SIM card on the day they arrive, pick up from the airport, help them settle into the system, which is quite complex in its own way, and guiding them through progressing for their ST3, 4, or Caesar applications. So, but that way we are very glad what we've done because every single doctor is happy. And on the other flip side, the NHS organizations we work with, they're also very happy because of the quality and the support we've done. That way it's successful. And what led me to do it, I think there was a problem. I've been seeing this through since 2014 onwards, and when I was part of the interview panel along with my consultant and registrar sitting there, and then hardly there were any applications for orthopedic SHO jobs. There were like 2 or 3, and these were I didn't mean in the wrong way, doctors who left medicine 7, 8 years ago, driving taxis in the UK on refugee status, but these were hardly the ever applications that had come through. And I see that there are doctors like me from the Indian subcontinent, not just India. I think most recruitment happens IMG, Egypt, Nigeria, India, Pakistan, Bangladesh, Sri Lanka. These are the predominant countries. And then now a little bit moving towards the Southeast Asia as well. And they are aspiring to come. I thought like, right, there is going to be a surge because I went through one cycle. Cycle is going to come back all over again. We could be stay in the forefront and give them the right introduction, right? Tell them the truth because grass looks green. And I remember the days when we came, how difficult and hard it was for us. These guys don't have to go through all those pains. And that's why we build the system. We kind of enhance with a bit of a tech factor into it so that it would become easier onboarding or settling in. I did my fellowships and did the mini MBA from Stanford, so that helped as well as an entrepreneur. Yeah.
Thank you for explaining that. We're just going to quickly finish up by asking the last question, which I think a lot of people want to know. Like, since we're new and we have trust issues, are recruitment agencies the way to go, or should we err on the side of caution?
Um, I mean, particularly this applies more to the lab doctors, Rupali, and I would say getting into a job is really the most important thing. And my first advice is register with NHS jobs, keep applying on NHS jobs. And that is has to be the way forward. If you are not getting what you're really expecting or a job or even the opportunity to be shortlisted, then register with the recruitment agencies. Nothing wrong in them. But remember, this is really crucial for any doctor. Never ever pay a single penny to a recruitment agency because recruitment agencies get supported and funded by the NHS trust. And I have come across and heard so many of the spam or scamming recruitment agencies, and you definitely have to stay away from them. Anyone who asks you to sign on a dotted line a contract, again, stay away from them. Where like you cannot leave a job come what may. No. By the way, employment law in the UK is quite strong, and it usually supports the employees. As a doctor
Mhm.
working in a hospital or even a private hospital, you're an employee, it's usually supportive. So dotted line contracts, you should keep away. But again, focus on your career and progress in that direction. NHS jobs, then trusted where your friends have used an agency, maybe nothing wrong in it. Whichever opens an opportunity for you, why not?
I'm really glad for your candor because most people will just be like, take my agency. Like, it's the best thing. We'll get you a job tomorrow. But I really appreciate how real you've been about what the actual situation's like. And there are no false promises being made about, oh, we'll get you a job in an hour and you'll have an interview and you'll have a job in hand. No, they'll get you to the right place where you need to be, and they'll support you throughout. So because a lot of us come in, and when I came in with your pre-employment and stuff, we didn't know anything. I was just reading blogs and Facebook and Reddit, and that's how I got my information, which is not a great source of information. But that's what you clutch on straws, you talk to people, and that's how you figure it out. So I think it's a really good option if you're someone who's starting out and have been struggling to get jobs, as I know a lot of people are. So if nothing else is working out, if you're not able to crack the NHS job system, I think it's okay to give it a try. Just be careful, don't pay people. Don't get scammed. Just be careful about it.
Yes, absolutely. Never ever give your card details or pay any money. No fair agency should ever be charging you. That's very crucial. Despite, however, be the more vulnerable you are, more longer you wait, and then you become more susceptible for these scams. So keep away from them. There will be, I've heard of agencies who promise, like, say, without doing PLAB, or I can pass the exam for you and give you a certificate result. Please stay away from them. That is one, but you mentioned about pre-employment. That is a common issue I come across a lot. I still work in NHS as a doctor, and that's a common issue. So I think maybe you should conduct yourself, or there has to be another small half an hour session telling about what exactly is
Yeah,
occupational health requirement, what is mandatory training, what exactly is the distinction, DBS and police clearance certificate, or how to fill up your NHS new starter form, and then where to get the bank account.
definitely. Yeah,
Pre-employment issues, I think they will be immensely helpful as well.
definitely. That's the next video I have planned, and I'll bring you on board for your inputs as well. So I think that's good for today's session. Thank you for shedding light on so many important topics and simplifying the process. I think for a lot of us who are like confused and don't know how it works. So I'm really grateful that you came on, and I hope that a lot of people get in touch with you and start connecting with you on LinkedIn. And I will also try to speak to registrars and get more senior residents on board if I can.
Definitely. We do have a Facebook page. I'm not an
Mhm.
active person on social media, but
Mhm.
so LinkedIn, definitely I'm a bit more active than Facebook or Insta. But we do have a Facebook page. Please do follow if you can, and that would be
I
great.
will put all the links down below so you can find all the information you need and connect with Naveen. And I hope you have a nice day.
And
Bye
good luck,
now.
everyone. Bye now.